Okay, so thank you Cheryl and Sean for giving us that example or that patient scenario. Now what I want to do is go through some of the informatics concepts that you saw in the scenario and point those out to you so that you understand what they were doing. Decision support example for VTE. What a decision support sort of guides the user as they're caring for the patient to make the correct decisions. It sort of helps you so you don't have to rely on memory any longer. You have technology to use as your tool. So that as Cheryl was going through, this is the VTE prophylaxis assessment that is done on every patient at our hospital. And it's becoming a national patient safety goal, and as well as to qualify for meaningful use, we must assess each patient for VTE prophylaxis. What we did when we created this form, VTE prophylaxis admission assessment. Each patient when they come into the hospital has to be assessed for VTE, as at risk for VTE. So based on what the nurse documents here, this side of the form has all the exclusion criteria. This side of the form is things that we already have covered in a post-op care set, and so this just goes into a black hole or whatever. And if you notice here, if the patient is an active bleeding patient, they would check that and they would be done with the form. If you see the patient has an INR greater than 2, that displays in the section here. And the patient would be clicked, we would click yes, and the patient would not get any heparin or VTE prophylaxis. Same with the platelets. If the platelets are less than 50,000, those results display here. If the patient is already on heparin, that medication profile is listed here, and it shows the list of medications that the patient is on. And the reference text, the VTE reference text, if you saw it in the scenario, Cheryl right-clicked in the reference text and she saw two things. One was how to complete this form. So if there's a new nurse or somebody who hasn't done it in a while and they don't understand how this form works, just by right-clicking over here, there's a little PowerPoint that's built in to show them how to complete it. And the other thing that was in there was what is heparin-induced thrombocytopenia. And it tells the nurse, maybe it's a new graduate, sort of closes that gap between a new nurse and an expert nurse, telling them what heparin-induced thrombocytopenia is. So that is one example of decision support, is our VTE prophylaxis assessment. And this shows behind the evidence base on that form. This talks about the VTE and the heparin that I just explained. We also had in the scenario a reminder to provide imperative data. You saw that several times when Cheryl was on the intervention list. These are things that help the nurse to organize their day, organize their time. The nurse has so many things coming at them in a 12-hour and 8-hour day that it's sometimes really hard to remember everything. So these are timed and dated, and many times you can see the last time it was done, so that you only need to go to one place to find out what is due for that patient. It's very important when you're designing an electronic medical record not to inundate the nurse with these reminders, because it could become an unmanageable list and then the nurse doesn't want to even look at it. So what we have to do is strategically place these reminders to the nurses, and we ask for their feedback and we have them help us design which reminders they want to go here. And it reminds her to add the heparin allergy because she clicked the patient had an allergy to heparin from the VTE prophylaxis. That patient should never get heparin. It's a safety mechanism. Now the nurse is reminded because they weren't in the allergy section. If the nurse clicks on this, it takes them right to the allergy section so that she can add that straight from here. She doesn't have to go find it in the chart. The pre-procedure checklist is loaded here, and again, smoking cessation education, because the patient said that she was a former smoker, that patient has to have smoking cessation education, so that when that identified learner is there and the patient is there and they're ready to learn, the nurse can then pull up this intervention list, click right here, and after she's done teaching, document the patient's response to that education. For data mining, there's a couple other things. There's multiple ways you can data mine. These are just a couple examples. The nurses have something called a PAL, a patient access list, in their computerized documentation system. Most software companies have similar things. It's just how do they use it and how do they display it. but once you understand the informatics concepts, you can use almost any software in the same way. So for this type of software, we have a column here that we loaded at our hospital for our nurses because they wanted easy access to the H&P on a patient so that when they're getting a report or when they're getting a new patient, it's a very easy way to get to that information. So we were able to display a history and physical column here, and when they click that, they get the history and physical for the patient. Another way to use data mining is when you're in the lab results section and you're looking up the labs, there is a way to trend these. There's a way to graph them, there's a way to trend them, and it gives you multiple different options to how to view that information. Not everybody likes to view it in the same way, and so there's different options for you to view that, and that's another example of data mining. If you noticed in the simulation scenario, it was very easy for Cheryl to see when the last time the patient received that pain medication. She simply went to the EMR summary and she could tell that earlier in the day the patient received Dilaudid 1 milligram. Before the computerized electronic medical record, we had to go and find the paper MAR, or in this case, rely on the report we received from the emergency department and maybe potentially go call them to find out when the patient received the last pain medication. This again provides information to the caregiver at the time that it is needed. Very important. So it's not what we're putting into the computer, it's how we're taking it out and using it to make these decisions quickly for our patient. When Cheryl asked the patient who their identified learner was, we don't want to teach not the wrong person, but we want to maximize the time we have with our patients. So we collect this information when the patient is admitted, and we ask them who takes care of certain things while they're at home, because we want to make sure that we have the right person when we are spending our valuable nursing or therapy or clinical team time. It has to be with the person who is going to be able to learn that information. So we display the learner on our plan of care, or this used to be called a Cardex, and it tells us, this is another example of data mining, because we can see right from here who their physicians are, which care plans we have on that patient, who the identified learner, and so on. It's a very quick way to get to this information. And our nurses were very instrumental in telling us what they wanted to see here. So when you have they wanted to see the physician's phone number because they needed a quick, easy way to get to the phone number. And so we loaded that onto our plan of care. Again, another example of data mining. When we are doing handoff communication, we like the SBAR, and I think that a lot of nurses like the SBAR format. There's a way to strategically pull data that we have inputted into the record and display it in an SBAR format, so that when the nurse is communicating with another nurse, with a physician, or with any other part of the care team, that data that has to do with the situation is all in one spot. And so you could go through this nursing SBAR view and see the information that you need when you want to give that report or talk about the patient. So you see many ways that we can use the computer as a tool to facilitate care of the patient. When we develop our care plans, our interdisciplinary care plans, we have to start focusing on what does the patient need to not come back into the hospital. There are so many things that we put on the patient's record to try to teach them, and they're very unrealistic. What I would like to see happen is that the nurse is the one who is the quarterback of the care team. The nurse is the one who is with the patient, deciding what that patient needs to know. Then everyone else who's touching that patient or caring for that patient should be able to focus on those same goals. So I see the interdisciplinary care plan as a tool to help the nurse and the team teach the patient a very focused items that would help them stay healthy and out of the hospital. In the example that we had in the scenario, the patient was a diabetic, a new diabetic. It would be impossible to teach the patient all the options that we have in the computer for diabetes. What we need to do is focus our time with that patient while we have them on something that would keep them out of the hospital. For example, how to treat a low blood sugar or a high blood sugar. let's take the low blood sugar. The patient everybody has taught the patient how to manage their blood sugar and their diet. The patient is much less likely to come into the hospital with a low blood sugar. The patient is at home and can treat it. Anyone who comes in contact with that patient, knowing that goal, can have a conversation or can arrange for the identified learner to teach about how to manage that blood glucose. This includes the case manager, the nurse, especially the nurse, the case manager, any respiratory therapist, a physical therapist if they happen to be in there, certainly the dietitian. The entire team should focus their teaching on a few things. And then when the patient goes home, we need to continue that teaching and set that up for the patient to complete the loop so that the patient learns about their diabetes and is much more able to stay at home and have that treatment successfully at home, and then they won't come back into the hospital. And that concludes my presentation for using technology to care through a new lens. I hope you enjoyed it, and I hope you find at least some ways to incorporate some informatics concepts into your teaching at your nursing education site. Thanks for your time.